Dr. Georgia, welcome.
Thank you very much, Hashi.
Welcome,
Wonderful.
welcome,
Very nice
doctor.
to meet both of you.
So happy to have you. So welcome. So to the viewers, welcome to the second Metabolic Health Conference of India. So I'm Shashi, a metabolic health coach associated with D Life, and I have with me Anup Singh, the founder of D Life, the oldest, largest, and award-winning low carb community of India. And Anup Singh, you can tell a couple of words about D Life.
Yeah, so D Life, we founded in 2014, and it was started for diabetics. But as we grew, we started adding content instead of letting it go as a community. We transformed it into a platform where now we offer courses in low carb nutrition, and more specifically, it is India centric. And I myself am a diabetic since 2011 on zero pills and A1C of 5.6 max all through. So
And of
that's
course, Anup Singh is an engineer. Again, one more engineer among many who are changing the nutritional paradigm. So I'll give a brief introduction about Dr. Georgia. She's well known in the psychiatric space, especially the metabolic psychiatry. So Dr. Georgia is an internationally recognized expert in nutrition and metabolic psychiatry. Her 25 years of clinical experience include 12 years at Smith College and Harvard University Health Services, where she was the first to offer students nutritional-based approach as an alternative to psychiatric medication. So Dr. Eid co-authored the first inpatient study of ketogenic diet for treatment-resistant mental illness, developed the first medically accredited course in ketogenic diet for mental health practitioners, and was honored to be named as a recipient of the Bazuki Brain Research Fund's first annual Metabolic Mind Award. Her new book, Change Your Diet, Change Your Mind, was released very recently in Jan 2024. So, of course, I am one of the privileged person to undergo your course also. So, welcome again, Dr. Georgia.
It's so good to see you again. Thank you very much for inviting me. It's wonderful to be here.
Yeah, no.
yeah. So what does the prevalence data say about mental health in the US and globally?
Yeah, so globally, almost 1 billion people in the world are suffering with a mental health condition that is so serious that it interferes to some extent with their ability to function. And that includes 1 in 5 of the world's children and adolescents. And here in the United States, nearly 1 in 4 adults have a mental health disorder. And among young adults, ages 18 to 25, it's 1 in 3. So it's very, very serious and worsening trend around the world and in the United States. And in India, I was reading about this in preparation for this very special meeting, and it was very interesting to me to learn that depending on which research paper you look at, you can see rates of up to 1 in 3 people in India may be suffering with a mental health condition of some kind that is really tragic and very, very concerning. And it's mostly depression. Really, the top 3, I found this very interesting. Depression is number 1, and that's true. That's true everywhere in the world. Anxiety, number 2, also true everywhere in the world. But what is number 3 in India is intellectual disabilities. And I found that very, very worrisome. What that signals to me is that in addition to lots of metabolic health problems, which we can talk about shortly, and I'm sure that lots of your conversations during this very special summit have been about metabolic problems in India. But when you see intellectual disabilities, that's a red flag for me for nutrient deficiencies, especially early in life. So there's this double problem in India of, too many of the wrong foods causing metabolic health problems. More than 200 million people in India have insulin resistance, and malnutrition. So you have too much of the wrong food and not enough of the right food. This is a deadly combination for the long-term health of the brain and for the good people of India.
And I think I was just going to talk something about the Indian data when you actually you have researched and done it. But then just to add to it, of course, no doubt the nutrition deficiency, especially the B12 deficiency, because people are primarily vegetarians here. And as a health coach who has been practicing independently for the last 1.5 year, I've been seeing terrible cases of B12 deficiency, vitamin D deficiency. And if it's a female, it's additionally iron deficiency. I think
Yes.
somewhere these are terrible in causing, and I have seen a couple of cases, the mild anxiety part when they have a low vitamin B12. And the
Absolutely.
moment they go and take an injectable B12, which provides them immediate relief within a week or so. In fact, I related long back to Dr. Chris Palmer also when we had a podcast that I had one of my colleagues coming in reporting anxiety. When I asked him, he was prescribed alprazolam by his doctor. I told him before you take this, get your B12 tested, and found it to be a decimal level. I told him before you take alprazolam, go and take B12. Meet your doctor, get an injection. Within a couple of weeks, this guy says that everything is resolved almost, and I'm almost free of anxiety. I mean, that is the level of B12 depletion causes.
That's a fantastic clinical case example of, how important nutrients are to brain function. The brain needs all of them. All of the essential nutrients are essential to the brain. And it is more challenging, of course, can be more challenging with a vegetarian diet to meet your nutrient requirements, but it's absolutely possible. Vegetarian diets are so much easier to construct a healthy and nutritious vegetarian diet than it is to construct a healthy, nutritious vegan diet. A vegetarian diet can provide all essential nutrients. You just have to know where those nutrients are. But there are certain nutrients which are more challenging. You have to take extra special care to make sure that you're getting these nutrients, and these include B12 and iron. So these are really important nutrients, particularly for the development of the brain in early life, and of course throughout the whole lifespan. We need them for the entire time that we're here. So, but particularly when the brain is being constructed in the first 1,000 days of life.
That's true. Yeah,
Yeah, just to highlight what Shashi said, his colleague was advised a drug. Now, the paradigm in mental health disorder is drug-centric. They don't look at anything else. So what is right and wrong with it? That is point number one. And point number two, how effective are these drugs?
Yes. So all of modern medicine has been for far too long very focused on medication treatments as opposed to treatments that improve people's overall health that are related to lifestyle, nutrition, exercise, spending time outside, and taking good care of yourself in general. We have a very medication-centered view of the world. And so this is unfortunate because medications are can be very useful. They can be very important. They can be very helpful in emergency situations. They can be helpful in situations where people are not able to change their diet. And there are certainly situations like that. And of course, healthy diet and lifestyle doesn't prevent or treat every condition we have. But it's clear that healthy diet and lifestyle can prevent and or treat most of the conditions that we are facing. And if you feed the body and brain properly, it will function properly for you, and you should need a lot less medication. Is absolutely true. So yes, the medications can be helpful, but they do fail most people. Most people do not respond fully to medications, meaning they don't bring people complete relief. And all medications come with side effects and sometimes very serious metabolic side effects. So I think it's good that we have medications. I'm glad that we have medications available for situations where they're needed. But in most cases, and this is the focus of my work and the focus of your work, is to help people reduce or eliminate their need for medication by feeding themselves properly.
Yeah, if I may add, ask a question in extension to that. You mentioned healthy diet. I am very sure that healthy diet is not the healthy pyramid that is, propagated all through the world.
You are absolutely correct. So yes, when we say healthy diet, and the reason I wrote this book is because changing your diet can be a really powerful mental health treatment. It can improve your mental health in very substantial ways in days to weeks. You can experience significant relief even from very serious mental health conditions. It can do more for you, more for your mental health. It can be more powerful than any medication. But you have to know which dietary changes are the right ones to make, because they're not the ones that we're used to hearing about. The diet that we're told is healthy for us is almost completely upside down and backwards from what the truth is. The biology, the truth of our biology says something very different. So most people, we've been fed the wrong information about nutrition for decades. And so we've been feeding our brains improperly our entire lives. And until you feed your brain properly, you have no idea what might be possible for you, how well you actually might be underneath all of that bad advice. So this is why I encourage people to learn more, kind of start fresh with a clean slate and restructure their diet in ways that make sense to the brain. In most cases, your brain is going to thank you very quickly for doing that.
So I understand that paradoxically, the very medication we use might cause insulin resistance or lead towards dysregulated blood sugar itself. So what is your thought on this?
Yes, and so we talked, of course, a lot about that in the course together, Shashi, and this is one of the dilemmas that people face with mental health conditions, especially serious mental illnesses like bipolar disorder, schizophrenia, severe major depression. There are a category of a family of medications that is more and more commonly used nowadays called the antipsychotic medications. And these are medicines, and I don't know what their names would be in India, so you might want to help me out with that. But, medicines like risperidone and olanzapine and quetiapine, aripiprazole, I'm not sure what else might be available there. But these medications, within minutes to hours of the very first dose of taking one of these medications, blood sugar and insulin levels can begin to rise. And so these medications are notorious for causing severe metabolic dysfunction, tremendous amounts of very stubborn weight gain, dozens of kilograms of weight gain, and type 2 diabetes, high triglyceride levels, tremendous appetite increase, and high blood pressure, cardiovascular disease. So these medications, while in some cases, this is actually the most powerful and effective medicines we have for serious mental illnesses. About approximately a third of people will get some meaningful relief from these medications when they're suffering with serious mental illness. But the price they have to pay for the relief that they get is a significant reduction in the quality of life and in the length of life that they will live. So it's as if they have to make this terrible decision between, do I want to be metabolically healthy or do I want to be mentally healthy? And this is where changing your diet can be your best friend, whether you take one of those medicines or not. And so, yes, we talked a lot about this in the course about how challenging this can be for patients who are facing these serious conditions.
And yes, these drugs are all available in India. Whatever you mentioned, everything is available. And I've dealt with these products long back when I was briefly in neuropsychiatry segment for a couple of years. So they're all available here and used with Anup.
Yeah, so, coming back to various theories behind mental disorder, of course, the mainstream would say it is primarily genetics. But in addition to genetics, what else?
Well, if it were only genetics, why would the rates of mental health disorders be rising at such a tremendous rate in recent decades? Our genes aren't changing, and so there are genetic vulnerabilities. Our genes do determine what we are at highest risk for, but our genes in most cases are not. I like to say our DNA does not determine our destiny. So our DNA, most of what our DNA does is tell us how we're going to malfunction if we don't treat ourselves properly. So, for example, some people, when they eat the wrong way, some of those people will get type 2 diabetes, some of those people will get Alzheimer's disease, some of those people will get fatty liver disease, some of those people will develop obesity, some will get heart disease. Which path you take, that's your DNA talking, but what sets you on any of those paths is almost entirely your lifestyle choices. So, we used to be taught in medical school that genes load the gun, but lifestyle pulls the trigger. And so this is most of what's going on. What's driving our mental health problems. We used to think, oh, it's all about genes and chemical imbalances, and it's you don't have enough serotonin, your dopamine isn't working properly. We need to fix these chemical imbalances with medications. That's been the belief since the 1940s. And now what we understand, really just in the past 10 or 15 years, is that it's largely driven, mental health issues largely driven by inflammation in the brain, something called oxidative stress, which is why we're told we're supposed to eat so many antioxidants, and insulin resistance or prediabetes, metabolic syndrome, high blood sugar levels, high insulin levels, however you want to describe it. These are the three major driving forces behind most of the mental health conditions and the physical health conditions that we are facing. Inflammation, oxidative stress, and insulin resistance.
So is it also that all these modern toxic seed oils and all also part of it?
Right. So most of what in the United States, more than 60% of what we're eating now is ultra-processed food. I looked very hard, and maybe you could tell me, maybe I couldn't find a percentage of ultra-processed food market share in India, but what I did find was that every person in India, on average, purchases nearly 0.5 kilogram of ultra-processed food per day. And ultra-processed food is the signature ingredients of ultra-processed foods are the refined carbohydrates like sugar, flour, cereals, and seed oils, refined seed oils, and so-called vegetable oils. These, you need to look no further than refined carbohydrates and seed oils to find all the ingredients you need for inflammation, oxidative stress, and insulin resistance. And the seed oils in particular are very powerful promoters of oxidative stress, very damaging for the brain. And so, and the refined carbohydrates, of course, very powerful promoters of all three of those forces, especially high insulin levels and insulin resistance, which gradually over time is going to rob your brain of energy. And so if all people do is if all anybody gets out of our discussion today is that you want to avoid these processed foods like the plague, then they're going to be healthier than most people around them. If they can only do that. We don't even need to talk about a ketogenic diet. Ketogenic diets are very powerful and wonderful interventions, but let's start with the basics. Let's just avoid these non-food products, which are cheap and convenient and addictive and destroying our brains from the inside out.
I did hear you talk about, about seed oils, and the usage is wide in India. So
Yeah.
forget about the ultra-processed food. They are there, but even at home, many of us actually use seed oil, and possibly even at home, they use this reused seed oil in the sense they will use it again and again. Let us say they use some food item which is deep fried. They will not discard the oil. They will keep it and they will reuse. And probably this is adding to more oxidative stress and cardiovascular problem, diabetes, insulin resistance, plus possibly a trigger for mental health also.
Shashi, what is the most popular seed oil that people use in their kitchens at home in India?
I guess there are a lot of it. Sunflower oil is one of the very popular one.
Uh-huh.
Safflower oil and rice bran oil are among the most popular used. Our traditional oil cooking fat has been ghee, which people have
Yes.
forgotten, and we have been using the other cold pressed groundnut oil, cold pressed coconut oil, coconut sesame oil, and mustard oil. So I know in US mustard oil is not used for cooking; it's used as a massage oil. But in India, these are the few traditional oils.
Interesting. Of course, if people could go back to using ghee and coconut oil, those types of traditional oils, that alone would be a tremendous step, just a really powerful step in the right direction. Is there a reason why people have stopped using ghee and coconut oil?
Yeah, that is the usual fear of cholesterol,
Saturated.
saturated fat,
Uh,
propagated by the American Heart Association. So even the traditional Indians who have always used ghee and or coconut oil, now they vilified it, and they are all going for seed oils as promoted by the great American Heart Association.
Well, there's absolutely nothing. I mean, there's absolutely nothing natural about a seed oil. It comes out of an oil refinery, takes 15 chemical steps, including very high heat, explosive solvents, high pressure systems. I mean, there's nothing natural or good about those products. And you open the bottle and smell them. They don't have any. They don't smell good. They don't taste good. And they're extremely fragile. You just look at them the wrong way and they fall apart. So, they're really, really dangerous. So it makes me sad to hear that this is happening, because one of the most delicious things about Indian cuisine is the ghee and the coconut and the delicious fats that are used to cook traditional foods with.
And of course, not to forget that in the commercial establishment, they do use what is called as vanaspati or those this trans fat.
Yeah, India's Crisco.
Really?
Yeah, they use it, and also palm oil. This palm oil is not those cold press or something. It is refined, bleached, and deodorized palm oil. So vanaspati or Crisco, as you will know very very nicely, and palm oil are two commonly used in commercial establishments.
This is palm's kernel oil, correct? Not the palm fruit oil, correct?
Yeah, yeah. So not the palm kernel oil, which is or which seems to be better, but these are all
Yes.
those refined, bleached, and deodorized one.
Yes. Oh, that's really sad.
So, what seems to be the see? You already told that frequent mental disorders are something like anxiety and depression. What about the other ones? Are they also increasing bipolar or schizoaffective disorders or other disorders? Are they increasing? How common it is?
Yes, all mental health disorders are increasing around the world, and it's difficult to be 100% sure that I mean, in part we are doing a better job of detecting these things. In part, people are feeling more comfortable reporting these things, but on top of that, there is clearly a rise in prevalence. So it's a combination of, thankfully, people coming forward more and us paying more attention, but it's not just that. It's also that the prevalence is rising, especially among our young people. So with each generation, with each passing generation, as our lifestyle deteriorates, as our diet deteriorates, as the toxicity of our environment worsens, we are becoming less and less mentally healthy with every passing generation.
Anu?
Yeah, before I come to next question, we would like to highlight one thing. Shashi, if you remember, we had a case of Rajneesh Bhatia. He was, I think, on 3 medications. Shashi can tell the names.
I
And
forgot.
of those
Yeah.
3, 2 were gone. And one was, the dose, I think, was reduced to almost half. And that was on low-carb, high-fat.
Fantastic. These are really powerful interventions. These interventions change brain chemistry, and not just the chemistry of the brain, but the architecture of the brain, the structure of the brain, and how the brain makes energy, not just the neurotransmitters and chemical imbalances. Yes, there's the chemical imbalances are involved, the neurotransmitters are involved, but that's just the brain isn't just a bag of neurotransmitters. There are all kinds of other things about the brain which are important to keep healthy. And if you feed your brain properly, it will heal itself. It will balance itself, and you will feel more stable from within and need less and sometimes no medication at all.
If I remember correctly, he was on one anti-schizophrenic drug, right?
He was on anti-schizo. I don't recall the drugs now. It's been quite a long time. I really forgot. But then it was the classical case. He also had uncontrolled blood sugar, and that got resolved with drastic reduction in psychiatric medications also. I think that was a classic case. We lost in contact with him right now. He's not reporting back, but then that time he was extremely happy doing this. So, Dr. Georgia, what is this nutritional and metabolic psychiatry? What is it about? We have not heard about it. At least I never heard about it when in my pharma days. Suddenly, last couple of years, a few years since we have been in Twitter, we have been in touch, we have been hearing something about this, and off late it is now exploding. What exactly is it?
So these are two brand new subspecialties in psychiatry, special areas of psychiatry, which are focused on the relationship between diet and mental health. So nutritional psychiatry, it's been around maybe 10 or 12 years or so, that the modern version of nutritional psychiatry. And nutritional psychiatry is basically the people who call themselves nutritional psychiatrists, and I consider myself a nutritional psychiatrist. We believe that the deterioration in mental health around the world is largely driven, not entirely, but largely driven by the deterioration in the quality of our diet. And so it's about dietary quality. And most thought leaders in the field of nutritional psychiatry who look at the so-called SAD diet or standard American diet, which is now global, of course, the global diet, global modern diet. Most thought leaders in nutritional psychiatry believe that people should change from that industrialized, standardized global diet to the Mediterranean diet. I am not one of those people. I don't think that the Mediterranean diet is the best choice for the brain, but it is certainly better. It's a better choice for the brain than the standard diet. And then there's another branch of psychiatry, even newer, maybe 6-7 years old now, called metabolic psychiatry. And I also consider myself a metabolic psychiatrist. We are interested in the relationship between metabolic health and mental health, meaning it's mostly about blood sugar and insulin levels and pre-diabetes and type 2 diabetes, and how your insulin, how the health of your insulin and glucose regulation systems, which is almost entirely about what you eat, how your glucose and insulin levels and your metabolic health affect your mental health. And so most psychiatrists and thought leaders in metabolic psychiatry are most interested in the ketogenic diet, because the ketogenic diet, by definition, you cannot get into ketosis. You can't generate ketones unless you're lowering those glucose and insulin levels. So a ketogenic diet works by lowering glucose and insulin levels. It's the high glucose and insulin levels that are causing the pre-diabetes and the diabetes and the insulin resistance and the brain energy, cutting off the supply of energy to the brain. So what I like to do, and I did this in the book, is I put these two concepts together, because we really need to focus on the quality, the nutritional quality of the diet. We need to nourish the brain with all essential nutrients. We need to protect it from damaging ingredients, and we need to energize it properly by keeping our glucose, by paying attention to our glucose and insulin levels and keeping them in a healthy range. So I think both of these fields, when you combine these two concepts of dietary quality and metabolic quality, that's when you get a really powerful intervention that is capable in some cases of completely resolving serious mental illnesses, sometimes even that have been present for decades.
So we found that of late there's a lot of talk about ketogenic diet and mental health. Of course, we are jumping to this topic, very exciting topic, of course, because this whole event is focused on ketogenic diet. So the success rate we see is great. Do you also have intractable cases? Someone who does not respond to either low carb, ketogenic, or even carnivore. Have you seen such cases?
Of course. And, I mean, I've worked with hundreds of patients over the years using nutrition interventions, and I use a variety of different strategies in my work, and I give people a variety of options in the book too, so that I realize that there are many people who are not going to want to eat a ketogenic diet. So there are definitely plenty of other ways you can improve the quality of your diet and your brain healthiness. But I use a variety of strategies. And so, as I was saying, hundreds of patients over the years, maybe a dozen years or so. And I used to say I could count on one hand, but now I can count on less than two hands the number of people who have not improved to a noticeable and meaningful extent by changing their diet in these ways. And so it's very unusual to see somebody who does not experience meaningful improvement to their mental health by changing their diet in the right ways.
So if you have some of them, would they request some other form of treatment?
So what I do when I get stuck with somebody and I've tried everything I can think of, is I refer them to functional medicine, a psychiatrist who's trained in functional medicine, where there's additional training in that community for to do deeper testing, for example, or try different supplements or different kinds of interventions that I don't have experience with or training in. And so that's what I will usually do. There's a wonderful a training program, a fellowship training program run by Dr. James Greenblatt here in the United States. It's available virtually, and it's called Psychiatry Redefined. And he has a lot of experience in using a lot of non-medication treatments and specialized testing to try to understand some of the other root causes of mental health conditions, whereas my focus is, and my love is really the nutrition piece. So, but I don't have the experience or training in the functional medicine piece. So that's what I will usually do.
Fine. I think that's a very valuable point, which I think we need to remember, especially those of us who are working in this space. Now, a lot of exciting thing is happening in this space of the trials and studies, especially those funded by the Bazooki group. I think it's
Yes.
big waves with Metabolic Mind. So what is it about this latest study which has just come out from Stanford?
Yes, so Dr. Shabani Sethi, who's metabolic psychiatrist at Stanford University in California here in the US, she just published in the past 2 weeks a 4-month study of a ketogenic diet in people with bipolar disorder and schizophrenia. And these were also people who had at least one marker of poor metabolic health. And so she showed that with the ketogenic diet, that everyone's metabolic symptoms, 100% of their metabolic symptoms disappeared. So this was a wonderful finding in and of itself. But then also that on the whole, 79% of patients experienced meaningful improvement in their psychiatric symptoms, and the ones who were the most adherent to the diet, 100% of those people experienced meaningful improvement in their mental health. So this was, again, a really promising study among a number of other studies that have been done. And there are studies now being conducted, as you said, around the world, looking at lots of different types of psychiatric conditions, and to understand whether or not the ketogenic diet could be useful in treating a wide variety of psychiatric conditions. And many of these studies are very generously supported by the Bazooki Brain Research Fund, a wonderful philanthropic nonprofit organization, which is supporting education and advocacy and research projects in metabolic psychiatry.
I think that's very interesting. I mean, when we hear the story of Matt Bazooki recovering with bipolar. So these studies are on which all fronts? It is bipolar or schizo, or is it anything else?
You mean the ones that are underway or the ones that have already been published?
Either way, published or underway. Significant
Yeah,
ones.
so the three studies that have been published since 2022 on serious mental illness, these are all really promising, and they're all trending in the same direction, which is very encouraging. So, for example, the study that I helped to publish in 2022, 31 patients in a hospital setting with serious mental illnesses. Every single 28 of them stayed on the diet, and of those 28, every single one of them improved to a really substantial extent. And 43% of them achieved clinical remission on a ketogenic diet, simple whole foods ketogenic diet. These were people with treatment-resistant mental illnesses for an average of 10 years illness.
Which mental illness specifically?
Yes, so these were 31. This was the work of my friend and colleague, Dr. Albert Denat in Toulouse, France, who a psychiatrist in practice for more than 35 years. He invited 31 of his most treatment-resistant patients with bipolar disorder, schizophrenia, and severe major depression, who had been ill for an average of 10 years, some for as long as 30 years. They came into the hospital voluntarily. They were already taking an average of 5 psychiatric medications when they came into the hospital, and they'd all been hospitalized before, one or multiple times. They've tried multiple medications. They've been in psychotherapy. They tried everything that he could think of. He asked them if they would be willing to try a ketogenic diet. They did, and tremendous improvements, not just in metabolic health, but in psychiatric symptoms. As I was saying, 43% of them achieved clinical remission, and 64% of them left the hospital on less psychiatric medication. You do not see results like this in conventional inpatient psychiatric care. And then Dr. Ian Campbell, a researcher at the University of Edinburgh in Scotland, who put his own bipolar disorder into full sustained remission more than 7 years ago with a ketogenic diet. He is doing some really exciting research in bipolar disorder. He published a paper recently, a pilot study showing that people with bipolar disorder, if they followed a ketogenic diet, they saw improvements in mood and energy and anxiety levels, irritability, and they saw really dramatic reductions in a brain neurotransmitter called glutamate. The levels of glutamate in the brain came down more than any other researchers that has ever been able to record or document. And that's important because glutamate is an excitatory neurotransmitter that can overstimulate the brain if the levels are too high and can cause a lot of damage. And so just switching them to a ketogenic diet, he documented using these very special imaging scans called magnetic resonance spectroscopy that their levels of brain glutamate came down by about 10% or more. And so this is a really exciting finding, showing that yes, the ketogenic diet is a powerful intervention that can change your brain chemistry. So these 3 studies, Dr. Denant's study, Dr. Campbell's study, and Dr. Sethi's study, these are all in major mental illnesses I was trained as a psychiatrist to think of as chronic and incurable. I was never taught to even aim for remission, to even expect that people could go into remission. And that is what we are, that I think that is really the promise of these interventions, is that some people, we don't know how many, what percentage, that remission is possible. And I think that's a message that most people are not accustomed to hearing.
So tell us about your book.
My book, yes. So my book is called Change Your Diet, Change Your Mind. And the reason I wrote the book is because I wanted to put all the information about nutrition and mental health in one place, so that people with mental health conditions, anybody out there who's worried about their mental health, who wants to know what the most effective ways are of improving your mental health using dietary changes, can find the answers to all their questions in this book. it's, we take apart a lot of the nutrition myths that are standing in the way, standing in between you and your good mental health, are a lot of nutrition myths that you need to set aside in order to make progress. And so we talk about mental health. We talk about all your different food groups, all your favorite foods, the pros and cons of meat, the pros and cons of dairy, the pros and cons of eggs, the pros and cons of beans, and whatever you're interested in, it's there. But then also we talk about ketogenic diets and how they work. And we talk about nutrients and which foods contain the nutrients your brain needs. We talk about how to build a healthy brain from during the first 1,000 days of life, during pregnancy up to the age 2, critical window of development. And we talk about different dietary strategies that you can use to improve your mental health. And these include whole foods diets, ketogenic diets, carnivore diets. And there's a whole chapter in the book about how you can figure out, evaluate your own metabolic health. You can do a lot of these tests yourself at home for no money, figure out, whether or not you have insulin resistance, and you can see how easy it is to reverse it. It's really, if you have the right information, you can correct these underlying markers of insulin resistance, things like high insulin levels and high glucose levels and high triglycerides, and you can correct those things within days to weeks if you have the right information. It's very empowering. I mean, I wrote this book because I want people, one of the other things I read about when I was learning about mental health in India in preparing for talking with you was it's bad here in the US, but it is much worse in India. It's very difficult to access mental health care services in India. And so the good news is that there's so much you can do yourself if you have the right information to reduce your need for mental health professionals and prevent these conditions in the first place. And sometimes even if you're already struggling with one of these conditions, to turn that condition around. There's so much you can do yourself without medication if you have the right information.
Wonderful, really wonderful. And that's what I was lamenting earlier also, that we don't have a single metabolic or nutritional psychiatrist in India.
Wow.
So I think we really, I know maybe, we need to get some doctors from India trained under you so that they can start looking at this angle. Though I do know 1 or 2 psychiatrists who seem to be more amenable to change for this, but then I think largely still there's a big space in this gap.
If you know of psychiatrists who are interested in learning about metabolic psychiatry, please put them in touch with me. And if there are financial barriers to learning, I will work something out to help people learn more about this. Because I think the fact that there's absolutely nobody in India who is able to work this way, I would like to do something about that. So put them in touch with me and we'll see what we can do.
Anup?
Yeah, finally, doctor, what's your message to India? Because specifically with respect to ketogenic diet, because the moment they hear ketogenic diet, the perception is kidneys will fail, or one would land into, if he's a diabetic, he would land into diabetic ketoacidosis.
Oh, yes, very important to correct those perceptions. So what damages the kidneys is high blood sugar. It's people with type 2 diabetes that are at the highest risk for kidney damage, kidney failure, and dialysis. And so the healthiest thing you can do for your kidneys is take in less sugar and take that sugary pressure off of your kidneys. There actually have been studies published, including one by Dr. David Unwin in the United Kingdom, showing that a low carbohydrate diet improves the health of the kidneys. It doesn't damage the kidneys. In fact, exactly the opposite. And then the other very common myth about ketogenic diets, or confusion anyway, is that ketosis and ketoacidosis are the same thing. So ketosis is a natural, normal metabolic state where you've got some ketones in your blood to help support your cell's energy supply. You've got a mixture. You don't run entirely on ketones. You still have blood sugar. So you've got a mixture of glucose and ketones in your bloodstream to help support all of your cell's energy supply safely, a combination, a mixture. Ketoacidosis is a very unhealthy and dangerous state of runaway ketone production, where you've got tremendous amounts of ketones accumulating in the blood. That's very dangerous. It's a medical emergency. This is only possible if you have no insulin at all in your system. So if you have type 1 diabetes, this is a possibility. Or if you're taking certain medications which interfere with your normal metabolic stop sign. Your body has a natural stop sign inside that says, okay, we have just the right amount of ketones. We're not going to let them go any higher. Ketoacidosis is dangerous, abnormal, runaway ketone production. Levels of ketones are 5, 10, 20 times higher than the healthy level that we are designed to be able to use for energy.
Thank you. Thank you for your insightful session, and I'm sure that your message will give an informed decision to people that they can have a nutrition approach to whatever psychiatric problem they have. Your book will provide a valuable insight. Thank you, and namaste from India, and
Thank you.
we'll see you again.
Thank you very much. Have a wonderful day, everybody.